So now we see how, if you are suffering from endometriosis, how should your doctor go about treatment and what are your treatment options. So the first thing is that suppose you've just incidentally gone for a normal checkup, etc., or a laparoscopy for maybe an appendix. Okay, and during the appendix you've undergone laparoscopy and the doctor also tells you that, look, you have mild endometriosis, but you have no symptoms, no pain, no heavy bleeding, you're not trying for pregnancy, or you already have children and it's just incidentally diagnosed, then you don't have to do anything. You are lucky. So you just observe yourself, but yes, follow up, keep your symptoms in mind, etc. But most of the patients definitely are symptomatic. So the treatment has to be standardized based on the age of the patient and the needs of the patient. If it's a mild case where she's having mild period pain, etc., a simple drug therapy would work. But if the symptoms are way too advanced, or if it's a person who wants contraception as well, or has completed family bearing, there is a device called as the Mirena, which is like a copper T, but it is hormone secretory. So it keeps the lining of the endometrium very thin and it prevents it from growing. So that is called as a Mirena. It greatly helps in the symptoms. In cases laparoscopy is needed where there is a cyst in the ovary, like I showed you the ultrasound picture, if there is an ovarian cyst that is causing severe pain, of course that has to be removed with laparoscopy. And in very, very severe cases of endometriosis which are not responding to anything, the final option is to go ahead and do a hysterectomy with removal of the tubes in the ovaries. The most distressing question of endometriosis, next slide, is there a cure? So unfortunately, there is no cure. It is a condition that you have to realize that, yes, I have this. I have to alter my lifestyle sometimes. I might have to take some medication occasionally, and I might have to deal with it. If you are lucky with a prolonged duration of treatment, the disease could go into regression and might disappear on its own. But unfortunately, as a doctor, I can't label and give you saying that yes, there is a cure. You might specifically after pregnancy. Pregnancy they claim is the only cure because for 9 months you're not going to have your periods, etc. The hormone imbalance that is causing the uterus to grow, that is the lining of the endometrium to grow, that is estrogen, is kept under control by the pregnancy hormone progesterone, which is in a much higher quantity, and therefore it induces changes in the endometrium and might cure you. But of course, there is no definite cure for endometriosis. Are there preventive strategies? Yes, there are preventive strategies. This is basically more for doctors who are planning a procedure on you rather than you. So as a non-medico, as maybe an IT professional, etc., you can't particularly do anything to prevent yourself from having endometriosis unless you take oral contraceptive pills for a very long duration of time, and then they are found to have a protective effect against endometriosis. But as such, suppose you have to go in for a tubal testing or your doctor has advised an HSG, etc. All procedures should not be done immediately post-menstrually because, like I said, we don't want anything that is going backwards from the uterus to the tubes to the exterior. If you are menstruating and undergo a procedure which is on your uterus, there are chances you might land up with endometriosis. So if you go to your doctor, telling your doctor about your last menstrual period, so any procedure that has to be planned, etc., can be planned keeping in mind that you are immediately post-menstrual. So we should wait for some time before planning any procedure on your uterus.